Start from the very beginning. Let me even bring myself up here. Welcome to MG Wellness's Ask a Doctor. We're starting from the very beginning. All those who missed the beginning, now you are live. You can hear us good. I'm glad about that. I appreciate it. And in fact, let me bring up this really quickly. If you have questions, you can do that through support@mgwellness.org if you want to stay anonymous. We understand some people want to have health questions. They want to stay anonymous. Obviously, we'll see your email, but it won't be shared publicly here. Or you can comment here right on Facebook Live, and we'll be getting and following all that. As we do that, I'm going to start us over and bring Dr. Kelly and Dr. John up. I'm going to do this correctly this time, now that we have audio. Dr. Kelly, Dr. John, how are you this evening? Again, for the second time.
We
Wonderful.
Are fabulous.
They saw you but didn't hear you, and life is not as good when we don't hear Dr. Kelly and Dr. John.
Sometimes it is.
So, let's start. Tonight's topic, cancer and obesity. We're going to be answering your health questions and your nutrition questions and lots of things, but we're going to be talking about specifically cancer and obesity. So let's start that over. The answer is going to be even better the second time. Only I got it here the first time. What is obesity? What is cancer?
So
before we get to that, let us wish our host for the evening happy birthday, Nate.
It is Nate Manahan's birthday today.
Thank you.
He is doing a live MG Wellness event, the Big 4-3. So I want everybody who is on to congratulate Nate. Happy birthday. And
we love you.
Thank you very much
for all that he does for us. So big shout out to Nate. Okay, so let's start with the definition of obesity. So obesity is defined by something that we call BMI, or body mass index. And body mass index is really a measurement of weight compared to height. And it's calculated in metric terms, and it's squared and all of this. But the easiest thing to do is to Google it. And yes, I just used that as a verb. Google BMI, and you can calculate your own body mass index. And what body mass index does is it compares, or it contrasts, the difference between maybe somebody who's 6'7" and weighs 300 pounds versus somebody who's 4'11" and weighs 300 pounds. And so body mass index is kind of a measure of our body's fatness. And there are different categories of BMI. So anything less than 25 is considered normal. 25 to 29 is considered overweight. 30 to 39 is considered obese. And then 40 and over is considered severely obese. And those different categories are important in terms of risks for certain cancers that we're going to discuss.
And lots of other diseases. But that segues into cancers. And by the way, BMI, body mass index, not Baltimore International, just if you were wondering. Sorry. So what is cancer? Cancer is abnormal growth of cells that have very specific characteristics. What characteristics are those? The first is that the cells are able to invade locally. Second one is that they're able to spread, that these cells can spread or metastasize throughout the body. The third one is that the cells have lost their normal programming cell death, so that they continue on immortally when they should have naturally died. Every cell in the body has a programmed time that they should live for, and cancer cells lose that. Those are the three main characteristics. The fourth one is that even when a patient is at the end of life and is essentially starving because of the cancer, or undergoing what we call anorexia or cachexia of cancer, that the cancer continues to grow despite being starved of outside nutrition. And so if you put all that together, you have what cancer is.
So those are the basic definitions of obesity and cancer.
All right, so we got a couple questions right out. So Sherry asked, bringing that up here on the screen, what's the true definition of obesity versus overweight?
So the difference is really a measurement of BMI. So like I said, just enter Google body mass index, and there's a body mass index or BMI calculator. There's usually one for free that comes up, and you can enter your weight, and you can do it in pounds, and then you can do your height in our normal feet and inches, and there's a conversion into the metric system, and that can then calculate your BMI. So overweight is a BMI of 25 to 29. Obesity is defined as a BMI of 30 to 39. 40 and over is severely obese. So those are the definitions.
Or morbidly obese.
Right, or morbidly obese. Sometimes
And
it's called
under
that.
20, and this is looking at adults, not looking at
Right.
teenagers, not looking at children. This is looking at adults. There's different definitions for that. And BMI, as Dr. Kelly was saying, is in kilograms per meter squared. So you don't have to know the kilograms. You don't have to know how many meters tall you are. We're Americans. We don't know it, even though we had to learn it in grade school.
Just Google it,
And
enter your data, and it will calculate it for you.
All right, so next up, I think, well, you may choose to answer this further as we go to some other questions, but the next question that came in from Sherry again was asking, what are the cancers that are more prevalent in obese people? I don't know if you want to start there.
So we can. There's a lot.
There's a lot of different cancers, and I think we'll probably we'll just name several of them, but then we'll draw a distinction between those that are most associated with overweight, obesity, severely obese.
And some of the ones that are related to obesity are ones that you think of because they're the more common cancers, such as...
Well, I'm going to just name several of them.
Okay.
Meningioma, thyroid cancers, esophageal cancers, colon cancers, breast cancers, endometrial or uterine cancers, ovarian cancers, kidney cancers, which are called renal cell carcinomas, stomach cancers, gallbladder cancers, liver cancers, even multiple myeloma.
And remember, when we're talking about these diseases, we're talking about where they originate, not a cancer that starts someplace else and ends up in the liver, but a true hepatocellular carcinoma, a cancer that starts in the liver, or a cancer that starts in the ovary, not something that spreads to the ovary.
Right. So the cancers, out of all those lots of cancers that we mentioned, the ones that are most associated or at the greatest risk if someone is obese.
More than, and the way we defined it is more than double
The normal risk.
that if you are, I shouldn't say normal weight anymore,
Normal
because now
BMI.
70% of people are overweight or obese. But if you are in the normal BMI, that 20 to 25 or to 24.9, those that are doubled are.
Right. The double risk is the endometrial cancers or a certain type of uterine cancer, renal cell carcinomas or kidney cancers, stomach cancers, liver cancers, and esophageal cancers. Those are the ones that have the greatest risk of the ones that we mentioned with obesity.
Yeah, they increase the most
Yes.
with increasing weight. And if you look at endometrial cancer specifically, as weight increases, so does the risk of developing endometrial cancer, to the point where if you're just 50 pounds overweight, your increase is almost 10 times what it would be if you were at standard weight.
Yeah, so endometrial cancer is the one that we use as an example with our patients of the more overweight that you are, the greater your risk of the development of endometrial cancer is.
So we're going to keep, the questions are coming in, so we won't.
Good.
That's a good thing. So, and keeping up with the same topic, are there specific cancer screenings that an obese patient should request from their doctor more than those who might be not obese or overweight?
No.
Yeah, that's a great question. But at this point, by the United States Preventative Task Force, the USPTF, by the National Comprehensive Cancer Network, the NCI, there are truly no increased screenings there are no increased screenings just for asymptomatic people for obesity. For instance, if there are some changes, so if you're 28 years old, I'm just giving you an example, 28 years old and you're having normal, and you are normal weight, but have abnormal bleeding, you do not have to jump to a biopsy of the uterus. It's not wrong to, but you don't have to. If someone's obese and they have abnormal periods, even if they're 28, then you would jump. But that's not a screening, that's a diagnosis.
So I think the point that Dr. John is making is that one of the things that's really, really important for patients who are overweight, obese, or severely obese is to be very aware of symptoms that might herald the need for further testing.
However, just asymptomatic screening does not change based on weight at this time from any of the major organizations that give screening guidelines.
But if a woman has abnormal periods and is overweight, that raises the risk for a uterine cancer.
If there's blood in the urine and you're overweight. But those are diagnostic tests, not screening tests.
Correct. So I hope that makes sense between diagnostic and screening.
All right, so asking the kind of inverse of the question, Teresa asks, do your chances for those cancers exponentially fall as one loses weight?
No.
So there are...
Well, okay, it matters what you're defining. There is a baseline. That baseline is based on normal weight. If you are morbidly obese and lose weight, can you go back to normal? If that's what you're asking, that's a different question.
So one of the difficulties in interpreting the studies that surround weight and risk of cancers is that the diet of everybody, and by diet I don't mean fad diets, but the food intake of everybody in that study,
the nutritional intake,
right, is variable.
And why was the weight lost? Was it lost because you have advanced cancer already, or was it lost because you were trying to lose weight? So there are no good studies looking at cancer in that. There are studies looking at other diseases, such as if you're morbidly obese and you lose weight, your heart disease risk goes down, but that's a different story.
So the overall consensus of, let's talk about weight control. So if you come from a long line of family members who've struggled with obesity, but you have done a very good job of controlling weight and limiting weight gain, do you decrease your risk of these cancers that we talked about? Yes, it appears that you do. Early age weight control really does seem to decrease the risk of these cancers that we're talking about.
Any disease process, we call all of these chronic diseases. Any of the disease processes take years to occur. You know, for instance, and this is an old statistic and you can look it up, but it's true, to find a 1 centimeter breast cancer means that the original cell that became a cancer cell and grew into this 1 centimeter breast cancer was 8 years ago. So if you're going to affect your long-term outcome, the best time to do it is earlier in life, like
Right.
Dr. Kelly's saying.
The studies on weight loss, just like Dr. John was saying earlier, the answer is not as clear if you can protect yourself from the risk of cancer, because we're not always sure in these studies the reason for the weight loss. Was the weight loss intentional, or was it unintentional that you had other illnesses, cancer or other chronic diseases, that caused you to lose the weight? The final category that they've looked at in terms of risk, and this is something that Dr. John was referring to a moment ago, is gastric bypass has become something that is incredibly popular, and I'm sure that there are probably some on the call tonight who have undergone that procedure. And it does appear that some cancers are decreased in risk in those who've undergone gastric bypass and lost weight, and heart disease appears to be decreased. However, some of the things that we have observed in taking care of patients who've undergone gastric bypass is that because the processing or the absorption and digestion of proteins is more challenging, then keeping up healthy protein stores is very difficult for patients, and that makes healing very challenging.
And on top of that, anyone who's been through, whether it's a gastric sleeve, a gastric bypass,
Right.
Roux-en-Y, however it's done, completely changes the gut microbiome and its effect on everything in the body. And so that's another issue with it. That's not to say don't do it. It's just to say that it's definitely different, and there's other difficulties you put in place. An interesting study, not on cancer, but on childbearing, recently came out about gastric bypass to show women that were morbidly obese versus women that were morbidly obese and went through gastric bypass and then had kids on both sides. Those that had a gastric bypass had much lower rate of abnormalities in the kids. There are multiple, when someone is morbidly obese, it causes huge risks in childbearing, not just to themselves, but to the child they're bearing.
Right, exactly. The children can have problems just from the obesity itself. Okay.
All right, so I have more questions coming that you have posted in both in our email and also here in the comments section. But I wanted to remind you that you can make sure you're on the email of MG Wellness, mgwellnessnewsletter.com. You can sign up, put your email in there. Please do that. That would be great. It would also be great if you are watching this live, or if you're watching a recorded version of this after on demand later. Please share with your friends and family. This information, we believe, is very important to make sure people are hearing and thinking about and digesting, and certainly that is a better thing when we can share it with our friends and family. And if you want
Instead of another cat video.
Yes. I don't know what that came from, but Don wanted to talk about a cat video.
all right.
Random
People
thought.
share
So-
cat videos all the time.
They do.
All right, so you can email support@mgwellness.org. You can put your comment here for your questions. And as we bring Dr. Kelly and Dr. John back up, let me ask the next question here. So are areas of the world, or even here in the United States, where lowest BMI per capita is relevant there, is that causing less rate in cancer, or are
Yes.
there too many other external factors?
Well, in the United States, we can look at that specifically because it's hard to look at other countries and then compare it to the United States. Areas that have lower BMI do have lower cancer rates of these specific cancers. It does not mean that they have lower rates of all cancers, because there's other issues that come into effect. But when you look at the rate of, for instance, endometrial cancer in states that have high BMI compared to lower than average, there's a much higher rate of endometrial cancer in the high BMI population. When you look at things like esophageal, you have to throw in smoking and alcohol also, but there is a difference based on BMI, and that's where this information actually comes from. That question is kind of the reverse of it, but that's how they've determined it, looking at BMI compared to the normal. And so,
Yes. And I think one of the challenges as we have gotten into 70% of U.S. adults being overweight, obese, or severely obese is that some of those differences in population have changed a little bit, where we're seeing more obesity in areas that of the country that didn't used to have that type of obesity. So anyway, yes, that's absolutely true. It's different among different populations.
So let's talk about what areas of research are most being researched right now when it comes to both obesity and its effect on cancer, and then its reduced risk of cancer.
So I think the first thing is what Dr. John just mentioned a moment ago, and that is the gut microbiome, which if you've been with us for any of our sessions, we, oh my goodness, have become totally transformed believers in the connection between gut and our health. And obesity and the connection to kind of it's called a dysbiosis, but it's a dysfunctional gut. And the good bacteria that are supposed to be there that we destroy by feeding our body processed, highly ultra processed foods.
and one of the things that's been found with obesity is that obesity itself carries a relatively inflammatory environment in the body. And this has been shown now to be one of the factors of why cancer is many of these cancers are more common in the obese, because just obesity itself, even if you think you're healthy otherwise, creates this low-grade inflammation that allows cancer to form. Just a constant irritation of all the body's cells. And a lot of this is caused by, as Dr. Kelly's saying, the change in the gut with processed foods.
So we've talked about this before. I'm going to review this because I think review is important. We've talked about the fact that 60 to 80% of our immune system is located within our gut. And for cancer to form, there are normal checkpoints in our body that cancer cells somehow escape. And the immune system is one of those. And so when our gut is dysfunctional, by not having proper bacteria, by being fed processed and ultra-processed food, then what happens is that the immune system dysfunction leads to not catching and killing those cancer cells, and those cancer cells escape that checkpoint and go on to grow and wreak havoc.
And so things to remember out of this are that obesity is one of the causes of what we call lifestyle cancers. And now 80% roughly of cancers are lifestyle cancers. You have 30% that are related to smoking, 30% directly related to diet. You have 15% related to obesity, so you're already up to 75%. You have 4% that are related to sedentary or inactivity. Then you have several that are related on top of that, so you're at 79%, to alcohol, to sexual behaviors. And once you look at that, you're talking over 80% of the cancers have been shown through research to be directly related to lifestyle choices.
So if there's one takeaway that we want you guys to understand from tonight and even some of the other lives that we're doing over the next month, think about that. Over 80% of cancer diagnoses, over 80%, can be changed by lifestyle changes.
And prevented, when she's saying change.
Right.
Prevented. And the earlier in life that you change, that you make that lifestyle change, the better chance you have of preventing that cancer from forming.
That's the best treatment for cancer, right? The best treatment for cancer is to prevent it altogether.
And only we can do that. You have to make that decision yourself. Drug companies don't make money off of you doing that. But that doesn't mean you shouldn't. Drug companies are going to keep researching their multi-million-dollar drugs, where every drug is $100,000. Every drug that's coming out now is $100,000 a year or more, and has lots of side effects that unfortunately we've seen up close, and friends of ours have seen up close. These drugs that they say have no, are safe. Well, that's a relative term.
Right.
Especially when you're dealing with cancer. A lot of things that would not be acceptable in the general public are acceptable because people are facing a life-threatening disease.
Right. So think about if you could make a lifestyle change that would prevent the formation of cancer. It's a huge game changer to think about the fact that over 80% of the cancers that are diagnosed in the United States are based on lifestyle choices. So.
All right, let me group. Get my mic back on. Let me group a couple questions here. We're going to get to everybody's questions that are in here. Those who are both, I have a couple email ones and some ones here on Facebook. I'll add these in. One, is there a difference between rural and urban when you're looking at it? This kind of goes flashes back to when we were talking about differences of different populations, different states. And then I'm going to group this together, and the next question is on immune system and cancer. So is there an increased risk for those with autoimmune diseases to develop cancer with the risk of immune system certainly playing into a higher risk of cancer?
Mm-hmm. Go ahead. You can answer that one.
No, I was going to talk about the rural and
urban. Go ahead.
So there is a lack of health care both in rural America and in urban America. That's been shown across the board. Most health care is provided in suburban America. If you look at a city like Atlanta, for instance, the center, Fulton County, versus the donut around, where are all the physicians in the state of Georgia? 90% roughly are in that donut around the Fulton County, which is Atlanta itself. Everybody says we're in Atlanta. Well, they're not. They're in the donut around it. And that's suburban versus there is a lack of healthcare in urban areas and in rural America. And you see these issues with obesity, with lifestyle choices nowadays in both. There used to be different issues, but now they kind of mirror each other, where, like, if you look in the state of Indiana, for instance, the difficulty with drugs was Indianapolis and the urban center of Indianapolis and the urban center of the other large cities in the state. But now there's a county, I know the city, but I can't remember the county now, that's about 50 miles north of Indianapolis that has the highest use of IV drugs and meth in the state of Indiana. And it's a very rural area.
So you're finding it in those extremes of urban and rural lifestyle.
In fact, the greatest increase in HIV related to needle use was in a rural county in southern Indiana, south of Bloomington, which made national news a few years ago.
Many years ago.
Okay, I'm always off by a few. Yeah, I mean, Michigan won the national championship
a long time ago.
21 years ago.
Right.
It wasn't yesterday, but we did beat Notre Dame. Anyway, so rural and urban have very similar
struggles
problems
right now. Yes. Related to the question on autoimmune disease, so autoimmune diseases are actually one of the most rapidly rising diagnoses in the United States. And there's increasing evidence that this gut dysfunction, the dysbiosis in gut microbiome or good bacteria, is more and more being found to be related to autoimmune diseases. And yes, if there is a struggle within the immune system, might that normal checkpoint, what happens when somebody has an autoimmune disease is we give medications, as physicians, we give medications to quiet the immune system. And not only does that cause more dysfunction of the gut microbiome, but it then causes a quieting of the action of the immune system, and therefore potential increase in lack of checkpoints.
And so the data is not perfectly straightforward.
Right.
Besides just what Dr. Kelly said, the other issue is the length of life with people with autoimmune disease is shorter on average than the length of life for people that don't have it. And so you're not looking at apples to apples for exposure with cancers either.
But dysfunction in the immune system is certainly...
And it's definitely related.
Right. Hope that makes sense.
I think it does. And now let's go to more of a specific question. Someone's asking, they're diagnosed with stage 1 invasive ductal carcinoma, estrogen and progesterone positive. Diet changes and hormone inhibitors necessary. Does soy affect this cancer?
So I'm going to start the answer to that question, and then Dr. John's going to finish because this is one of his favorite things to talk about. So I would highly, highly encourage anybody who has that same question to listen to any talk by a Dr. Christy Funk, F-U-N-K. She is a breast surgical oncologist, and she is incredibly well-read on this particular topic. Soy, despite what many doctors say, is not something that makes breast cancer grow. In fact, it is anti-breast cancer. Phytoestrogens in soy, are not absorbed well, and they do not act like estrogens in our body.
Well, that would be B.
Sorry.
So, like Dr. Kelly was saying, it's a big point because people hear the word estrogen and they think, oh my gosh,
right,
phytoestrogens. Yeah, it's totally different. I mean, there is data showing. Let me tell you, for instance, first of all, yes, you should take what your doctor's recommending, whether it's a selective estrogen receptor modulator like tamoxifen or an aromatase inhibitor, Arimidex, Femara, anastrozole, any of those. Yes, you should take it. But what's interesting is people talk about tamoxifen. Tamoxifin's a great drug, and it has saved thousands of lives. What people don't tell you is what the original study on tamoxifen was against. It was actually a study of tamoxifen versus diethylstilbestrol, which is estrogen. And understand that the diethylstilbestrol and tamoxifen were equal in their ability to treat breast cancer. So just because something's estrogen receptor positive does not mean that estrogen is going to
make it grow.
Mm-hmm. Why does an anti-estrogen work then? The reason is there are at least 5 different estrogen receptors, and no, they don't look for which one it is. But there's at least 5, and these were, 15 years ago we discovered there were 5. And so I'm sure there's more now that we don't even know. But there's estrogen alpha 1, alpha 2, beta 1, beta 2, and beta 3. And so estrogen is not the evil that people think it is when you actually look through the data. But
soy,
more importantly, soy is actually beneficial, and going to a plant-based diet plant-based protein diet, even with soy, is beneficial for people that have breast cancer.
Right. So there are lots of studies, over 8, very nicely done studies that show benefit of protection from breast cancer and recurrence of breast cancer with the consumption of soy.
Even GMO soy, which
Most of it is in the United States.
and we can't get away from it.
So, mentioning irritation that we mentioned a few moments ago, the question here goes, when I go several days away from milk, whether it's soy, almond, or oat, and then I take milk, I'm assuming cow's milk, wow, does my digestive system get irritated? Is that an obvious sign to get off milk permanently?
Yes.
Tee that up.
Yes,
there is
please.
no reason that anybody above the age of 2 should be consuming dairy. I know people love cheese.
And if you do, and you're on here, please stop eating cheese.
People love cheese. They love ice cream. Understand that. Would you consume your next door neighbor's breast milk?
No.
Then why would you take the breast milk from a cow? Think about that for a minute. That's what you're doing. You are consuming breast milk from a cow. What's it supposed to do? It's supposed to make you turn into a cow. So what does consuming dairy do? It makes people bigger. And dairy completely inflames, irritates the gut microbiome. It just messes it up. So
that's the reason that you feel irritation and a little kickback is that your gut is telling you, please don't do that anymore. Yeah, it's just not good for you.
There's no benefit. It does not help with bones. It has actually been shown that it may actually cause more problems. It does not help with athletic performance. None of those things are correct. Studies have been done to prove it. All of those statements from the Dairy Council and all that are just statements out there. They're not done with fact.
Right. A lot of those, in fact, just a few weeks ago, we reported on some studies that touted the benefits of dairy. And if you look at who supported those studies, it was by the Dairy Council. And so you have to be very, very careful when you look at those studies, and they're very sensationalized in the media. You got to look at who has supported that study. So, yeah, we highly recommend removing dairy.
No, that's true yellow journalism.
That's yellow journalism. Yes.
So, all right. So we're going to just a little bit more time tonight. We'll go right up till 9 o'clock Eastern time here. But let me remind you, please make sure you've signed up to mgwellnessnewsletter.com. We want to make sure everybody gets our newsletter as it comes out. And then also, if you have questions, we have a few minutes left here. I think some people, I think we've gotten all to the questions we have right now, but if you have any last minute questions, you can email to them at support@mgwellness.org, or you can comment here, right here, live on Facebook. As we close and getting down, here's what I'm interested in. What is one tip, suggestion, the top thing you would recommend to 3 different groups of people? People that are obese, people that are overweight, and people that are right where they should be with their weight. What should they do to reduce their cancer risk and to also increase their healthy lifestyle?
First one for everybody, exercise. Exercise independently in all of those groups decreases your risk of cancer. And I didn't even put that in the 80+%. I said about sedentary, but I didn't talk about the fact that exercise actually decreases. So when I'm saying exercise, 30 minutes of straight
continuous walking
5 days a week. She always corrects me when I say straight walking. You don't have to walk in a straight line, but you do have to walk 30 minutes continuously, not 5 minutes on, 5 minutes off. So that would be what I would say to all those groups. What's the first thing you can do is exercise.
To all of those groups, I would also say, as we have said 1,000 times before,
Plant-based protein
get
diet.
off processed foods. boxes, bags, cans, things that have a chemical experiment in the ingredients on the food that you're eating. It should just not be that way.
Decreases your risk of cancer by 20 to 25%, decreasing your processed food intake.
Right. And so I would say not just decrease it. I know it's really, really hard to remove
Stop
it completely,
it.
but just really do everything that you possibly can to eat whole foods. Like,
And when we say whole foods, explain what you mean by whole foods.
Yes.
Because we've had some people go,
what does that mean?
I'm supposed to eat a whole potato? No.
But when you go into the produce section of the store, those things that are under the little spritzers and laying out beautifully, that are all different bright colors, those are whole foods.
And whole foods can also be fish,
Correct.
as opposed to a fish paste or a fish stick.
Or a fish square. How many fish have you seen that are the shape of a square?
Yeah, you don't
Not
see
very
too many
many.
fish going, I'm a rectangle.
Right. So you've heard about shopping in the periphery of the store, right? Around
I
the
haven't
edges.
heard of this.
Yes.
That's what I do, but I've never heard that.
Right. You in the center are all those boxes, bags, and cans. The things that can sit on a shelf for a year and not rot. And that's not normal. Whole foods are things that, given time, they're going to rot. And that means that they are actually beneficial to you when they're not rotted. They're beneficial to you.
We could actually even
To your
talk-
body.
We could even talk about the difference between rotted and actually bad for you. Those are different things.
Okay, we'll talk about that next time. But anyway, removing processed foods is really
Agree.
a really, really important
Agree,
thing.
absolutely.
So let's kind of draw the distinction between what should people who are in the overweight and obese categories do.
Get rid of all soda. All soda.
Soda is evil.
And it doesn't matter if it's diet or regular. They both are horrible for you. They increase weight. They increase diabetes. They increase strokes.
They actually have done studies to show that if you drink any type of soda with your meal, you will eat more
Even a
Then-
diet soda.
than if you drink water with your meal. You will just eat more. So soda should be removed. Dairy should be removed. An anti-inflammatory plant-based protein diet is the only thing that is first going to heal your gut. You're not going to lose weight until you heal your gut,
Yeah, you can't lose weight to get healthy.
unless you heal your gut. So those are the really, really important points to try to begin that gut healing process. Don't begin the weight loss journey and do yet another diet. They don't work. Don't count calories. It
It's got to
doesn't
be,
work.
as our kids have said, it's got to be a lifestyle change, not a diet.
Just saying, I'm gonna put good fuel in my body. That's just the decision.
Healing your gut, you will lose weight. You will get to a new natural balance.
Yes, a new normal.
Well, let's end. One, I'm going to ask you a question about MG Wellness, but I also think it is October 30th. Tomorrow is Sugar Palooza, known as Halloween, where 170 million people have bought over an average of $80 of candy for their here in the U.S.
Holy
I just
cow.
looked that up. I'll bring that.
We have
I'll
purchased none, so don't come to our house.
And like the sign said about Jim Harbaugh,
So-
we'll give raisins.
I'm showing that up, but it's $9 billion in 2018 was the number of how much candy was sold. Sales
I'm nauseous.
in the United States. So we have lots of resources that we've talked about. We have a whole subject that, in fact, it'll be on our YouTube channel. You can go back in our Facebook links and stuff. We should share that tomorrow.
Yes.
For sure. We've talked about sugar in multiple ways, but let's just a quick refresher. Why should we just throw all the candy away on Halloween?
So most candy in the U.S. especially is made with high fructose corn syrup, preservatives, and dyes. These high processed foods are incredibly horrible for you.
They're addictive. They've actually been shown to be as addictive as IV drugs.
And we've had people complain saying, oh, that's not true. No, actually the data does show that.
Yeah, it's crazy. So the deal is, if you can, and I'm actually going to post this on MG Wellness. I'm going to post some healthy desserts, things that you can have that are healthy for you and are just fabulously tasty, but do not contain high fructose corn syrup, do not contain dyes, do not contain things that are harmful to your body, and can still make you feel like you're having a treat and enjoying Halloween and the festivities thereof. So high fructose corn syrup, it's evil. And you don't want your kids to have it, and you don't want to have it.
And contrary to the commercial that I've seen on TV, it is not natural.
No.
It is not a natural product.
If it says natural and it's candy, run for the hills.
All right. So we have a couple more questions that I just scrolled down here. So we're going to do 3 more minutes. It's 8:57, so we'll go right to 9 o'clock tonight. The best raw high antioxidant vegetables. So what are for gut and biome healing?
So,
Cruciferous.
well, you need prebiotics.
Yes.
A lot of the cruciferous vegetables and the allium family of vegetables are prebiotics, which are part of the healing of the gut, especially asparagus, onions, leeks, scallions. All of those,
Garlic,
thank you, are all great prebiotics that the probiotics or the good bacteria need. Even though we trash on bananas a little bit, bananas actually, the fiber that is in bananas is actually a good prebiotic for the bacteria also.
right.
For the positive bacteria.
So antioxidants are found in a lot of berries, and they can also be found in cruciferous vegetables. Cruciferous vegetables are broccoli, cauliflower, Brussels sprouts, that kind of bok choy, kale,
arugula and its peppery
Arugula,
taste,
yes.
as Dr. Kelly likes to say.
And then berries, blackberries, raspberries, strawberries, and
dark
blueberries.
berries,
Yes. All of those
have good
have
antioxidants.
very good antioxidants in them. There are also antioxidants in a lot of vegetables of lots of different varieties of colors. So anything in that produce section is going to be really full of that kind of thing for you.
And do try to stay organic. And the reason is a lot of the pesticides and fertilizers, which are hard to get off the vegetables and fruit, are very harmful.
And wash your stuff when you bring it home. Wash your vegetables, wash your fruit. It doesn't have to be, bleached out, but just wash them.
All right. On that, I think we're going to end. We will have lots of opportunities to answer questions in the next several weeks. Every Wednesday night, we are going to be live here for the next 3 or 4 weeks. I think we scheduled out. Next 4 weeks. Wednesdays at 8 o'clock. Make sure that you are following us at MG Wellness on Facebook. Right here on Facebook, you are watching this live. Make sure you're following our Instagram account at MG Wellness 1. That's over on Instagram, and there is so much good content coming from there. Dr. Kelly, Dr. John, can you give us just a quick synopsis of what's coming the first week of December when we launch our first course, How to Live Your Best Life when through chemo?
Okay. So we're super excited about a course that Dr. John and I have created to help you on your journey through and during chemotherapy. It's called How to Live Your Best Life While on Chemo. Pretty simple title, but really it takes you through the complete journey from diagnosis to getting through chemo with flying colors, and then follow up thereafter.
Yeah, so it talks about what is cancer with more detail than we talk about here, the types of cancer, treatments, chemotherapy, immunotherapy, side effects, typical Western medicine treatments of those, as well as evidence-based natural treatments. How to ask your doctor questions at your first visit, at follow-up visits, at the end. How to approach your doctor if you want a second opinion.
We also talk about nutrition, exercise, and techniques for de-stressing, which have all been shown to be incredibly important through the cancer journey. So we're super excited about this course and feel that it will be incredibly helpful information that we have accumulated through 40 combined years of taking care of patients going through chemotherapy. So we're kind of putting all of this knowledge into a course for you. So we hope that you'll connect with us on that.
Great. Thank you guys very much. I hope everyone has a wonderful Halloween filled
Be
with
safe.
organic vegetables and
Yay!
maybe a little bit of special treat, maybe an extra kombucha
I'll post
tomorrow.
some stuff.
All right. Have a wonderful evening, and we'll see you next week, 8 o'clock Eastern Time, next Wednesday.
Bye, guys.